important both in clinical and examination perspective. And today we'll discuss just the basics on how to detect a dental caries easily in your clinical setup. Patient complaint. Usually a patient will complain you of a discoloration on their tooth, or they might tell you they are having pain of different intensities like mild, moderate or severe, and they can let you know that they are sensitive towards hot or cold food or substances. But now we have to go into the clinical examination. First is the visual examination. Most of the time you can find a brown blackish discoloration on the tooth surface, and this will be mainly seen in the pit and fissure areas, or else you can see a cavity. There are certain limitations to this because there can be non-cavitated lesions. Next is your visual tactile method. Here, when you're using an explorer, the softened enamel, that is the softened enamel in your caries, it'll catch the explorer and it'll resist the removal of the explorer. Now here too we face many limitations, that is there might be a transmission of cariogenic bacteria from the affected to non-affected area, or irreversibly you can traumatize this lesions which could have normally remineralized. Okay. Next is to use the orthodontic tooth separators, that is your elastomeric or mechanical separators and wedges, in order to detect the proximal caries. Another method is to use a caries detector dye, that is these dyes, they actually don't stain the bacteria, but they do stain the collagen associated with less mineralized organic matrix. And here we use the basic fusion red stain, and these acid red stain, they can't be used for the lesions closer to the pulp. This is an example for a caries detector dye. Usually along with the packaging you will get the instructions specifically on how to use them. Radiographic examination, as we all know, you can confirm your diagnosis by using radiographic examination, that is your intraoral periapical radiograph, bite wing or OPG. Another method is fibro-optic transillumination, where the caries will appear as a dark shadow because the decayed tooth, it scatters more light and has a lower index of light transmission than a normal sound tooth structure. Here you can see there is a slight blackish discoloration using the fibro optic illumination. So that is how we can detect caries. That's all for now. We'll discuss more advanced technique in our upcoming videos. Please do like, share and subscribe to our channel. Thank you.